Hello, this is Lauren Clymer, and this is my 5-minute practice assessment video. This is Miss Amy, and her chief complaint is a headache. So now we will begin our assessment. Okay, Miss Amy, tell me when these headaches began.
Like 2 months ago.
Okay, and where do they hurt when you have these pains?
Temple, kind of in the front area.
Okay, and how long do they seem to last when you have these headaches?
The longest one was 2 days.
Okay, can you characterize the pain for me? What type of sensation are they?
Throbbing most of the time, and then sometimes there's sharp pains.
Is there any aggravating symptoms that seem to cause them, like any certain type of food or activity, alcohol?
No, not light.
Okay. And there are any associated symptoms like nausea, vomiting? You said you're sensitive to light,
Yeah.
sensitive to sound.
Sensitive to light, sound. Maybe 1 or 2 times I felt like I was going to be sick, but nothing actually happened.
Okay. Does anything seem to relieve these headaches?
I do ibuprofen.
Okay.
And then I just lay down with a cold rag.
Okay. And how often or frequent are the occurrences? Once a month, weekly? If you
Probably once a week, every week at least.
Okay. And the severity on a range of 0 to 10, how severe are they?
Probably a 6 or 7.
Okay. All right. Thank you for that information. We're going to move on to get some past medical history from you. So, have you ever been hospitalized?
No.
Okay. Any recent surgeries or past surgeries?
Past surgery, I had back surgery for a herniated disc.
Okay. What year was that?
2012.
Okay. Did you ever suffer from any childhood illnesses, measles, mumps, rheumatic fever, scarlet fever, chickenpox?
I had chickenpox.
Okay. Any adult illnesses, tuberculosis, hepatitis, diabetes, mellitus? Okay. Any car accidents, trauma, injuries, fractures? Okay. Um, any any immunizations that you've had in the past?
I have all of my shots.
MMR.
Yeah.
What about, have you ever been tested PPD for tuberculosis?
Yes.
Tests in your arm?
Yep.
Okay. What about the flu vaccine? Did you get the flu shot?
Not this year. I have in the past though.
Okay. We'll look into that at the end of the assessment.
I've also had Gardasil.
Okay. Gardasil vaccine. Okay. Thank you. Any current medications that you're on?
I take allergy medicine, Allegra, over the counter, and then I've been diagnosed with anxiety, so I have Ativan when needed.
Okay. And any, I know this is random, but have you had any blood transfusions in the past?
No.
Okay. And your allergies, food or drug allergies?
I'm allergic to penicillin. Food, I'm not.
Okay. When you take penicillin, do you know what happens to your body?
Anaphylactic shock.
Okay. And what about any mental health? You said you have anxiety. Any other mood disorders or?
No, just anxiety.
Okay. And are you up to date on your labs? You know, the last time you had a cholesterol test, lab, complete blood count?
They give us that at our school.
Okay.
So the beginning of the school year.
Okay, so yearly.
Yeah.
Okay. Well, if we could get a copy of that, that'd be great.
Okay.
Okay. The next set of questions just has to do with family medical history. Are your mother and father still living?
Mm-hmm.
Okay. Your mother or dad, either of them have any serious health issues such as cancers, diabetes, hypertension, hepatitis, kidney disease, rheumatologic disease, anything that you're aware of?
My dad had melanoma.
Okay.
In the past, a while ago, but it's been removed.
Okay. And your mom?
No.
No issues there? Okay. So they're in pretty good shape.
Yes.
Okay. Next question is just tell me a little bit about your social and personal history. So you went to college?
Mm-hmm. I went to University of Oklahoma.
Okay. So you have a bachelor's?
Yes.
Okay. And are you dating, single, married?
I am dating.
Okay. You live home alone, roommate?
I live alone in an apartment.
Okay. And you said, what's your occupation? What did you go to school for?
I am a teacher.
Okay.
I went to school for advertising, but I'm in the education.
So, and this is just simple health habits. How often do you exercise?
I used to exercise a lot, but since I'm working now, it's less, probably 2 or 3 times a month.
Okay. And do you use any tobacco products?
No.
Okay. What about alcohol?
Socially out.
Okay,
with
so
friends.
a couple times a week or more
Yeah.
or less? Okay.
Probably just a couple
Okay.
on the weekends.
And in one sitting, how much do you drink? 1 to 2 drink if you had to.
Like 2 beers.
Okay. And I think that about. Oh no, let's. So you said you do have a boyfriend.
Yes.
So you are sexually active.
Yes.
And do you use anything for birth control?
Yes, I have Mirena, the IUD.
Okay. All right. And you use condoms?
No.
Okay. Well, those are very important and prevent transmitting sexual infections. And I think we're pretty good there. So thank you for your honesty and participation. And that concludes our 5-minute practice assessment video. Thank you.